Assalamualaikum viewers and welcome back to our channel. Today in the playlist of oral and maxillofacial surgery, our topic for today's discussion is canine space infection. So as we have discussed every facial space infection in the following headings: boundaries, source of infection, contents, clinical features, any complication, or as far the management was concerned, we will study that in a separate video. We will study the management of odontogenic infection, underlying principles and guidelines. For that we will make a separate video, so you can refer on to that video. So moving back to our topic, canine space infection, the boundaries. First of all, inferiorly we can see in the diagram as well. Inferiorly we have the levator anguli oris, superiorly we have the levator labii superioris, medially we have the levator labii superioris equinesi. Laterally, we have the zygomaticus major and zygomaticus minor, and deep we can have the anterior surface of the maxilla, and superficially we have the levator labii superioris and skin. So source of infection, basically from where the infection originated, and that has led to the involvement of canine space. The canine space is also known as the infraorbital space. So source of infection involves a long rooted infected canine or premolar, but for premolar it is important if the premolar, the root is above the attachment of muscle. In that case it will lead to spread of infection into the canine space, or any extension of the buccal space infection can also involve the canine space as well. Now moving on towards the contents, basically what are the important contents that are present in the canine space or infraorbital space. So we have the angular artery and vein, or we have the infraorbital nerve. Clinical feature: obliteration of the nasolabial fold, cellulitis of the eyelid, swelling of the upper lip in the infraorbital region as well, and drooping of the angle of the mouth. So these were the important clinical feature to be noted. Any patient that is being presented with these clinical feature is a peculiar and a typical appearance of the canine space infection. So complication of canine space infection involve the cavernous sinus thrombosis. We have made a separate video on cavernous sinus thrombosis in which we have detail of this cavernous sinus thrombosis, the spread of infectious route through the anterior and the posterior route. So basically the canine space infection can spread to the cavernous sinus through the anterior route. That was basically including we have the angular vein present in the canine space. As if the angular vein is being involved, it will involve the superior ophthalmic vein, and infection from the superior ophthalmic vein will directly pass on to the cavernous sinus and will lead to the thrombosis of cavernous sinus. That could be fatal in case if it involves the central nervous system through the meningitis. It will lead to the coma, and it could also lead to the death. Now as far the management of canine space infection is concerned, we will see basically a spontaneous drainage that will occur along the medial or the lateral canthus of the eye, because that was the path of least resistance, and it is along either side of levator labii superioris that attaches to the infraorbital rim. So we'll see a spontaneous drainage will occur along this path. We can also go for incision and drainage. Incision could be intraorally or extraorally. Intraorally in the region of canine and premolar, we can have incision out there, and extraorally the incision will be given at the medial canthus of the eye. So this was all about the canine space infection. I hope this video will be helpful for you all. Don't forget to subscribe to our channel for more videos and updates. Thank you.